Good afternoon, everyone. Hello, good to see you. It's our honor to welcome all of you here to this online international symposium on COVID-19 and issues on global social justice. My name is Hikari Ishido. I'm professor of international economics at Chiba University, Japan. Please bear with me. I have to be wearing this mask because of the presence of all of my colleagues in the same room. So we still have to abide by this practice. So please bear with me. First, I'd like to share with you the background issue. Okay, so it's me. So I would like to share the screen. So this one. So can you see this PowerPoint file?
Oh, yes.
All right, thank you very much. So the title of today's online international workshop is COVID-19 and Issues on Global Social Justice. As we are fully aware, our 2 years almost have been devastated by the outbreak of COVID-19, and then there have been so many social issues, disastrous, or I should say maybe catastrophic. And then we should definitely think about the global kind of social justice, because most of us are doing research into globally oriented research into social justice. Mainly from the humanities and social sciences, but definitely with a focus on natural sciences as well. So the symposium today is organized by Chiba University Leading Research Promotion Program, and it has a branch research organ, Chiba Studies on Global Fair Society, which is led by our leader, Professor Jiro Mizushima. So he'll be making his opening remark. Thank you very much.
Hello, everyone. My name is Jiro Mizushima. I'm a political scientist at Chiba University, and at the same time, the director of the program, Chiba Studies on Global Fair Society. We are a team of interdisciplinary social scientists, including law, politics, economics, and sociology. We would like to tackle the problem related to COVID-19 from interdisciplinary approach. As Professor Ishido has explained it, the theme of this symposium is COVID-19 and issues on global social justice. Thank you for joining us. As Professor Ishido has demonstrated, the impact of COVID-19 is quite huge on global society. It is true that today or this month we are seeing the decrease of infections of COVID-19, and the world has come to the new phase. In many countries, the restrictions were lifted, and also in Japan, from this week, we see lesser restrictions. But we have to be cautious about the future, because in Japan, we are expecting the second wave of infections in the winter. Anyway, so the impact and the influence of COVID-19, we have to approach it from various kinds of approaches. And especially we are focusing on the aspect of fairness. So today we have 3 lectures, and after that we would like to discuss it. Thank you for this. Thank you for joining us to this symposium. Please go ahead. Thank you.
Okay, thank you so much, Professor Jiro Mizushima. So I'd like to continue with making some remarks on today's setup. So, okay, back to the PowerPoint file. This one. Okay. Right. So this is the list of speakers, panelists, and moderator. And then, by the way, please let us record the session for today for our later use. Especially, we would like to upload the recordings of today's symposium for public viewing and also for our research purposes. So please let us do so. Thank you so much for your collaboration. And then please mute your microphone when you're not speaking, but please mute yourself, of course, when you'd like to make any remark or comment later on. And also please make use of the chat line for clarifying your comments or questions whenever necessary. So thank you very much. So here is the list of speakers, panelists, and moderator for today. First, we will do welcome. I'm just explaining. First, we will be welcoming Professor Lindsay, Oades, University of Melbourne, Australia, and then he will be delivering his lecture on this topic. I will be later introducing his lecture title. And then Professor Masaya Kobayashi will be delivering his own lecture. And then followed by their lectures, Ms.Afsana, she will also be giving her speech or lecture. And then each of you have 20 minutes or so. And then following these presentations or lectures, we would like to have a panelist session. So first, Professor Jiro Mizushima will be coming back here again, and then discuss, those issues dealt with in the lectures, the 3 lectures, but maybe one by one, or put, some issues put together up to Professor Jiro Mizushima. And then after that, we'd like to welcome Professor Takayuki Kawase for his own making comment. And then his title is this one. Okay, I'll be introducing later. And then lastly, myself, Hikari Ishido, I will also be making my own comment. And then each of the panelists has maybe around 15 minutes for doing so. So, and then I'd like to try to moderate the whole session to the extent possible. Okay, so thank you very much. So if there is any question, please let us know in any way. Would that be all right? Okay, so let us move on to the first part. We have the honor of welcoming Professor Lindsay Oades of University of Melbourne, Australia, as the first speaker. Actually, my colleague, Professor Kobayashi, he is so knowledgeable on the impact made by Professor Lindsay's Oades research activities. And so can I pass on to Professor Kobayashi for making some brief comment on his work, please?
Thank you very much, Professor Oades, for participating in the seminar. I will briefly introduce your work to Japanese audience in Japanese. オーズ先生はですね、オーストラリアのメルボルン大学においてポジティブサイコロジーセンターの長でいらっしゃいます。そして業績はですね、さまざまな著書や論文で非常に有名なんですけれども、メンタルヘルスの問題ですね、精神的な健康の問題、それからコーチングのようなビジネス関係の問題、非常に領域が様々ですが、最近は特にですね、 システムに、導かれたポジティブサイコロジーという新しいアイデアを、世界に対して提案をしておられます。で、私たちがですね、確か2年前だったと思いますけれども、ちょうど林先生が中国に行かれる途中で、わざわざ日本に立ち寄ってくださって、小規模なセミナーを行いました。で、その時に、石戸先生や私も、お話をしたわけですけれども、その結果が、昨年、公共研究に、今年の初めですかね、載っております。で、実はですね、その後、大規模な、国際セミナーを開こうというふうに、大津先生と相談をしていたのですけれども、コロナ問題のために昨年は開催ができなくなってしまい、今回の国際セミナーに来ていただくという形になりました。そして今、ハイリンズ先生はですね、特に政治ポジティブサイコロジストの中では関心があります。ですから、ポジティブ、心理学者たちは大体個人のウェルビーイングに関心がある人が多いわけですけれども、それを政治や社会の観点と組み合わせて発展させていく。その時にシステムを使うという考え方を提起していらっしゃって、最近はオーズ先生たちのグループがですね、第3波、3つ目の波のポジティブサイコロジーという考え方も提案されていて、今年オンラインで行われたポジティブサイコロジーの国際学会でも非常にインパクトがあるお話でした。で、今日はですね、特にオーストラリアの状況を念頭において、ポジティブサイコロジーの観点から、こういった問題についてお話をしてくださるということです。どうぞ皆さんよろしくお願いいたします。
Thank you so much, Professor Kobayashi, for your introduction. So we would like to formally now welcome Professor Lindsay Oades for his lecture. And then the title of his lecture is Coping with COVID-19, Policy Response and Citizens' Well-being in Australia. So Professor Oades, please.
Thank you very much, and thank you very much, Professor Kobayashi. I'm very pleased to be joining all of you, and thank you very much for the invitation. Just to check, you can hear me okay? Yes. Okay. What I will do now is I will share my screen. And can you see that okay? Are you able to see my screen okay?
No, yeah, we see your face as of now.
Okay. One moment, please.
Sure, sure.
That looks better, yes?
Yeah. We see the slide. Thank you so much.
Okay, thank you for, as I said, thank you very much for inviting me. I'm very pleased to be here with you today. In the brief time I have, my goal really is to give you a sense of what's happening in the Australian context, the policy responses. I'll say a little bit about the well-being of people in Australia, but I'll particularly try to give you a sense of the politics behind the policy in Australia as it relates to the Australian Federation and how we're structured. And I'll try to point out to you, explain to you how I believe it's very much become a good example of a battle between a sort of conservative, liberal, individual view of the world and that side of politics versus a more progressive view of politics. And I'll explain the way that's played out across the different states of Australia. So I will just move this for a moment. put myself down there. There we go. So I want to explain a little bit about the Australia. I'm not sure how much people understand about Australia, but I will explain this because it gives a context in which the policy and political and ethical debates occur. So firstly, Australia is a federation of multiple states. We have a population of approaching 26 million. Our federal government, that is our national government, is currently a Liberal national coalition, so that's the conservative side of politics, and we are likely to have an election in March of next year. We have to have one before May. We are based, as in the map there, we have 6 states and 2 territory governments. So these states make up the federation for the federal government. The states are largely based from the original British colonies, and what you see there on the map is the states that are currently blue are the Liberal or Conservative states, as is the federal government, and then the states that are red are the more progressive states, which is the Australian Labor Party. But I'll now move you back up. Sorry, the screen was all worked out before, and then it kind of collapsed on me. But staying with the red and the blue for a moment, what you have in terms of the population in the New South Wales, which is the state of Sydney, which is where my cursor is, that is 8.18 million of our 26 million people. So 31, almost 32% of people are living in the New South Wales state, which is currently the conservative state, as well as the federal government is a conservative state. However, where I am down the bottom here in the red state of the progressive state, which is where Melbourne is, 26% of us in Australia are living there. So you have something about 57% of the whole population is living in these 2 states, and you will notice that one is conservative at the moment and one is progressive. And just to give you a sense of the journey that we have been on in terms of a time frame, so this is going back to March of 2020. We see 2 major clusters of cases of COVID in that time. Both of these are mostly occurred in Melbourne state, so in the progressive state. So you have a federal government which is conservative, promoting a certain ideology or view of the world, yet you have most of the cases and therefore most of the restrictions and lockdown and impact on the economy happening in a progressive state. And then much later, more recently, since June of this year, both Sydney and Melbourne, the 2 big states, the Delta variant came and impacted on both states. So that is a kind of a time frame, but I'm trying to illustrate, and I will say further about how that has impacted in the debates, both politically and in terms of policy. And you'll just see down the bottom there how the deaths obviously mirror the case numbers, and there's no real surprises there. By world standards, we probably have not had that huge amount of cases or deaths by our population, but it certainly hasn't been it's been far from perfect as well. So to put some context on that, as I've said, I'm trying to build a context here in which to understand the policy and the political debates. So the 2 biggest states, New South Wales and Victoria, were 57.3% of the population. So effectively the impact of that on the economy and most of the political debates are basically what is happening in New South Wales compared to what is happening in Victoria, and then what the federal government siding with New South Wales, that is being on the side of New South Wales, because that is the conservative side of politics. So what I'm arguing here is that the two states have represented the two different sides of conservative versus progressive ideology. And interestingly, the way we're set up, the way the health system is set up, the hospitals and public health is largely delivered by the state governments. So, for example, a health minister in New South Wales and a health minister in Victoria, whereas most of it's actually funded by the federal government. What we have also seen is unusually in Australia, normally we have premiers of each state, but also we've seen the rise of the chief health officers who had been advising the premiers about public health orders, and that has been very unusual in terms of the rise of the power of the separate states and the debates between them, so much so that our federal Prime Minister formed a national cabinet which included the federal government and all the state premiers making joint decisions, which is quite an unusual structure that we've never seen before. So we're seeing how COVID-19 and the policy and politics around it has been creating new developments in our very own democracy. What I want to highlight is that comparison that I've tried to highlight between the states and also how that's played out in the federal politics and the federal policy. So on the left-hand side here, we have what I call the liberal, economically liberal view, and socially conservative view, represented by the Liberal National Party, which is a coalition in our country. They are the current incumbent government at a federal level, but also they hold government in New South Wales, the most populous state. If we compare that to the progressive Australian Labor Party, they are currently not in federal power, but they are in power in government in the second most populous state, Victoria, which is where I am at the moment. And there is also a very strong leader. So you have these federal and the premier of the major populous state basically having a lot of political ideology and politics with the Australian Labor Party, the Victorian state. And that became very interesting in 2020 because it was the Victoria, the state on the right here, which was the one that had the big cases and also led to the major lockdowns and restrictions. So on the left, we had the federal government and New South Wales government promoting freedom and prioritising the economy, whereas in the locked down state of Victoria, we had the progressive government prioritising public health and providing support to people. And as I mentioned, in 2020, most of New South Wales and most of Australia had low infections, apart from a couple of outbreaks due to one cruise ship in Sydney, whereas things in Victoria, the progressive state, were very bad, and that was where we experienced our extended lockdown. So lockdown number 2 in what is called the second wave in Australia. In Melbourne, where I am, we've just finished our 6th lockdown. On the left-hand side, the other major debate, the federal government is responsible for vaccinations, and as I'll show in a moment, the Australian vaccination uptake for a wealthy nation like Australia was very slow, and there are debates about why that was, but in essence, it appears that the federal government simply did not order enough vaccinations in the first instance. So while these negative things are happening on the right-hand side in Victoria, we have Rupert Murdoch, who controls a lot of the Australian media. He's on the conservative side of politics. So while the progressive government is locking down Melbourne and Victoria, the conservative media across the country is attacking very heavily the Victorian government for being totalitarian and intervening too much and not caring about the economy or individual liberties and rights. More recently, this year in the second half of 2021, with the rise of the wave of infections due to the Delta virus, Sydney, New South Wales on the left became heavily infected, and they were prioritised due to that with the vaccines when they became available. However, on the right-hand side, the Victorian progressive state also got a Delta variant and again went into lockdown and have been playing catch up with the vaccinations. And so there's been a lot of political and policy debate about between the two states with the federal government on the side of New South Wales because it's a conservative government. To put this in context, as you know, Australia is a very large country. You have states like Western Australia who have been COVID zero for most of the 2 years. Queensland has had some outbreaks, but by and large, you have these huge land masses on the rest of the country that have been relatively untouched by COVID. So in essence, what's happening in Sydney and Melbourne has driven most of the debates. This will probably not be that similar to the rest of the world, but just looking at what sort of things we have done to prevent and contain COVID in Australia. Firstly, of course, testing and isolation, a lot of social distancing, contact tracing and the different improvements of contact tracing as they occurred, normal things like hand washing, many political and individual liberty debates about mask wearing, but essentially now mask wearing has become a major part of the Australian way of life in the cities. Of course, more recently, deep cleaning and ventilation in schools has become a major initiative. Quarantine, and the reason that's in red is the federal government is actually responsible for quarantining. However, they chose not to do it and they handed it to the states, and the quarantining was done largely in hotels, which has been not particularly successful. There have been multiple outbreaks from this, and once again, debates between the state and the federal governments. Because of that, and because of the slow vaccinations due to the delay in the vaccination supply, the state governments have relied heavily on restrictions and lockdowns. So locking down, not allowing people to go to work, to school, in Sydney and Melbourne having travel restrictions to 5 kilometres from one's home, not allowing to visit other people's homes, etc. And of course, over time, particularly in Melbourne, which has had 262 days of restrictions over 2 years across 6 lockdowns, people start to get very frustrated by that, and then they look for someone to blame, be it a state government or a federal government. So most of the arguments are about whose fault are these delays in the vaccination rates, and why do we need lockdowns for so long? One of the other big tools that we've seen is border closures, obviously internationally, but within the country itself, with certain states closing the borders to other people from other states, which has separated the country in a way that I have never seen in my lifetime. In the context of vaccinations, we first had AstraZeneca, the Oxford vaccination, which got a very bad reputation because it was promoted poorly, even though it's a successful vaccination. And more recently, Pfizer has become the main vaccination, and Moderna has been added. The current debates are really around the vaccination requirements on people to go back to work. And one of the issues is, should the state or the government mandate the vaccinations, or should they be a condition of work from the employer, which I will come back to. We're also seeing very recently the rise of some potential treatments for people who have contracted COVID. So essentially we've seen our way work through in a very messy way through the many possibilities of initiatives that could occur. To put that in a little bit of context, I was talking about the delays in the vaccinations. So again, for a wealthy nation like Australia, you would expect that we would get vaccinated and it would happen reasonably quickly, similar to a state like the United Kingdom or Canada. And you can see here Australia in the red. We made a very late start this year to increasing our vaccinations, but very recently we've made a very rapid increase in the vaccination. And of course, you'll probably compare that to Japan, which is actually not that dissimilar. It's probably a little late by world standards for a rich nation, but it still remains ahead of Australia. But during that lag period between, say, March and July, there was a lot of frustration and political debate because of the reliance on restrictions and lockdowns due to the low vaccination rates. So hopefully I've provided you with some context, both of how the nation and the government structure is, but I'm trying to emphasise how the very fact that the two largest states, New South Wales and Victoria, had governments of different political ideologies, has been almost a perfect storm in terms of a debate about individual and business rights versus public health and more progressive views of politics. One of the questions I'd like to leave you with, and which is very alive in this country at least, is the issue about being vaccinated. Most people are now getting vaccinated, and we will probably end up with a 95% vaccination rate for people above 12. But there is still a large debate about the individual rights, about vaccinations. There's still an active anti-vaccination group, not as much as in the US, but there is here. And one question I'll leave you with is, while there is a legal right to choose to not be vaccinated, is there a moral right to choose not to be vaccinated? In a practical way, one of the current debates, like the people protesting here, is should the government as a whole create conditions for vaccination requirements to work, or is it the role of individual employers and organisations to do that? So I will leave you with those questions. Hopefully I've provided you a bit of Australian context to at least add to some of the further discussions. Thank you very much. I look forward to hearing future presentations and being involved in discussions over the coming next half an hour or so. Thank you.
Well, thank you so much, Professor Oades, for your nice presentation on the status quo, and then in the context of political issues and also moral issues. I was intrigued by your discussion of the legal right and moral right. I heard that law is the minimum moral, and so maybe it is a good idea not to emphasize too much about your own legal right, but basically, those people who think that they have the legal right tend to emphasize that a little bit too much, and so that adds to the political battle and everything. So that's okay. Well, thank you very much. Later on, we would like to make some comments and ask questions to you. So if you could please, respond to those questions, that would be very much appreciated. So okay. So for now, we would like to move on to the next speaker, Professor Masaya Kobayashi, and then his title of the presentation is well-being and fairness under the crisis of COVID-19, a perspective from positive political psychology. Professor Kobayashi, please.
Thank you very much. So I will show you my slides. Could you show this? Right? Okay. So thank you for this opportunity of making some presentation on well-being and fairness in Corona Calamity. And so my presentation is from the viewpoint of positive political psychology. So at first, I will talk about something about this. And this is well-being social indicators, but the concept of positive political psychology is new, inspired by some overseas scholars, including Professor Oades. I push forward the idea of positive political psychology. This signifies the positive or collective, the first quadrant of this figure, because in most cases, positive psychology deals with individual psychology. And so I have made two surveys in 2020 and 2021. And so I investigate the relationship between well-being and corona calamity on this data. So this is the basic characteristics of participants of the two studies, but I will skip this. And so at first, I will use the indicators of Professor Martin Seligman well-being theory. That is the 5-dimensional well-being, positive emotion, engagement, relationship, meaning, and achievement. So this is the very popular in the present positive psychology. And so I investigate the change of well-being before and after Corona in 2020. That is subjective recognition of people. So it is easy to see the change of subjective well-being. This indicates almost all items shows a bad change. That is, well-being drops after Corona, especially engagement, happiness, and relationship. And also, I compare the change of well-being, change in well-being between first and second surveys. This slide shows the first survey 1 and survey 2. And as regards to survey 1, before Corona and after Corona. So we can see the results of the survey 1 and 2 are very close. And the numerical value of survey 2 is somewhat lower than survey 1. This means that survey 2 was conducted later. So the crisis or the decrease of well-being develops. And this slide shows the similar results by the usage of ICORP scale by Isaac Prudentensky and Miami University. The left-hand side shows the comparison between survey 1 and survey 2. We can see all numbers are lower in the survey 2. And the right-hand slide, right-hand figure shows the similar results by the satisfaction with life scale developed by Edina. And this slide shows the other indicators of well-being, such as work engagement, eudaimonia or hedonia, and orientation, and satisfaction and happiness. We can see the survey, the numbers are lower in survey 2 for almost all indicators. And this slide shows the other items. So there are some replacements of the items in the two surveys, but many are not much different. The number of survey 2 are clearly lower in only the green part. This part signifies the hedonia and eudaimonia orientation. And the other items are characters on social, economic, and political situations in Japan. So in these items, there are less difference between two surveys. So it signifies that well-being and orientation and characteristics, there is a big difference. But the other items, there is a little difference between two surveys. So we can see that actually the calamity of COVID-19 causes the decrease of well-being. Next slide. This slide shows changes in mind body and values. The items used in this section is mainly survey 1, because survey 2 does not include these items. Actually, the second survey was conducted by this project, that is the fairness project. And this is the survey 1. This is quite close to the former slide. This signifies that before Corona and after Corona. So the items shows remote work, rewarding sense, online environment, asset, income, sense of cost of living, dwelling, employment stability. And so some cases, obviously, there are decrease of well-being and values in these items. This is almost as imagined results. And this is the support for the ruling party. This slightly decreases after the corona. But this is the result in the first survey. And so I suppose that in the second survey and now at the present time, there is some more difference of the support of the ruling party. And this slide shows the life satisfaction, life hope, life happiness, and life anxiety. And so in general, positive people in satisfaction, hope, and happiness are generally more than negative people. But the same tendency appears in this study. But there are a lot of anxiety here than usual cases. This is the H74, life anxiety. This is surrounded by green columns. So it can be imagined as a result of the corona calamity. That signifies that life anxiety is one of the most conspicuous points. And we asked about the contents of anxiety. Right block signifies the items which can be imagined related with corona problem. And red block signifies infection diseases such as the new coronavirus. This is the major anxiety, but we can find, apart from the red block, there are various anxiety which are related with corona calamity. And also we analyze the relationship between the change of brightness and darkness with these. So I can see the increased brightness correlated with only emergency, disaster, and crime. On the other hand, increased darkness is related with everything except children and no anxiety. So the increased negativity is related almost all anxieties. And this slide shows a deterioration of mental state and bipolarization. It is interesting because we can easily imagine that the corona problem decreased people's happiness, but this slide shows both positive and negative people increased in survey 2 in comparison with survey 1. But there are people who have become more negative than usual, but there are also people who have become more positive in both surveys. This signifies, obviously, many people are more negative as the result of corona problem, but some people has become more positive after the corona. So we can see there is the trend of bipolarization. Obviously, the number of the people who became unhappy is more than the people who have become more happy. But these trends can be seen in both surveys. And this slide shows the changes of body or mental affairs and employment and income. So in most cases, slightly worse is a little more than somewhat improved. So this is in tune with our analysis of well-being. But in particular, the number of slightly worse is conspicuous in income change. So income change is more conspicuous than changes of physical or mental change and changes in employment state. So the increase of brightness is negatively correlated with physical and mental deterioration, and the increase in darkness, anxiety, and depression is positively correlated with all these deterioration. This slide shows people whose bonds with family and friends have become somewhat stronger, a little more than people whose bonds have become weaker. So basically, people's bonds with family and friends have a little increased. And people with negative moods are more than people with positive moods, and especially anxiety and stress. So this slide implies that there are noteworthy increase of people's bonds with family and friends. And obviously, negative moods such as anxiety and stress are popular, but some people experience joy, love, and hope. So this is the change of relationship and feelings. And this slide shows value change. And I have analyzed value changes on the basis of Maslow's hierarchy of need. So there is obviously value changes towards post-material values and materialistic values. The first post-material change corresponds to self-transcendence need or spirituality. And the second materialistic values corresponds to safety needs such as economy. So it is easy to understand that income anxiety causes materialistic values. But some people experience a value change towards post-materialistic values. And so there is also a bipolarization. And in contrast to these two, the other two needs of belonging and self-realization needs are not so conspicuous. So increased anxiety is positively correlated with increase of darkness, anxiety, and depression. Value review, change in values have positive correlation with both darkness, anxiety, and an increase of depression. So this signifies both changes value systems. And the next section is factors that influence well-being and changes, relationship with fairness. I have enumerated correlation in survey 1, especially with regard to well-being, economy, politics, society and community, and attributes. And it is impossible to read all these, so I have colored red, blue, purple, and green. So we can see these factors influence or are correlated with well-being. I have worked out on the same correlations in survey 2. And we can see also that well-being, economy, politics, society and culture, community, and attributes are related to well-being, increased positivity or negativity. And this slide shows the well-being has correlation with change of feeling. And it is impossible for the limit of time to go in details of these analysis, but this signifies that as a result of multiple regression analysis of well-being and four systems, we can see obviously well-being are related with these, but politics, especially fairness and justice, and economy, that is income, are negatively correlated with a negative direction. This is the result of change by ICOP on survey 1. The survey 1 shows that relationship and community, organization, physical, psychological, economy, and politics, there is some change before Corona and after Corona, as I said. And this is a result of multiple regression analysis concerning ICOP. And we can also see the same result with survey 1 and 2. This is dependent variables are changes of mood. So we can see psychological, physical well-being and interpersonal well-being are positive, and community and political well-being are negative. This means that political well-being is negatively correlated with darkness. That is, if we have high political well-being, we are less. We tend to be less become negative side. This is the survey 1. Also, a multiple regression analysis and change of mood is dependent variables. And dependent variables are 27 factors by explorative factor analysis. Well-being, negativity, and health have influenced as imagined. Hedonia is related to the increase of darkness. Eudaimonia is related to the constraint of darkness. Community and relations and civic publicness are related with the increase of brightness and the constraint of increase of darkness. These effects are more prominent than household budget. This is the same or similar analysis on survey 2. The relationship concerning psychological well-being, negativity, and health is the same as survey 1. Hedonia is related to brightness and darkness. Fairness constraints negative increase. Political negativity is related to negativity increase. And the conclusion, fairness and political well-being are inversely correlated with negativity. So we can understand that the fairness factor is one of the factors which are related to well-being. So I will focus on the relationship between citizenship, fairness, and justice, and well-being change of mood. And I skip this slide, but this analysis based on the assumptions from political philosophy. In particular, I am very interested in communitarian assumption, so I try to investigate the data from the communitarian assumption. And this slide shows the correlation between virtue-related indicator more than correlation concerning hedonic indicators. Therefore, the citizenship and justice are associated with virtues. This is quite in tune with communitarian assumption. Also, this is the same analysis on the second survey. These results are basically the same as the first survey. So this is also in tune with communitarian assumption. That is, the ethical element is related to justice and citizenship and well-being. And I also examined the correlation between justice, fairness, and citizenship and well-being. This correlation shows that there is substantial relationship between justice and fairness and citizenship and subjective well-being. And so I analyzed the data from the communitarian model of justice, citizenship, and well-being. And this is the result of the structure equation modeling. So we can find that this model fits the data. And this is also a complex model. I skipped this slide. And this slide shows the correlation between justice, fairness, or citizenship and change of mood. As I said, there are substantial correlation between justice, fairness, and citizenship, and subjective well-being. But also there are relationship between justice and fairness, or political liberty or citizenship, and brightness increase, darkness increase, anxiety increase, and depression increase. And I also made the same analysis by using the explorative factor analysis. The result is basically the same. There are some correlation between justice and fairness and citizenship, and brightness increase, darkness increase, anxiety increase, and depression increase. So this is the conclusion. It is a bit too a quick presentation of the data, but I summarize the conclusion from the analysis before. First, well-being decline, and there is a bipolarization. Well-being generally declined slightly due to corona calamity, including the general domains of well-being, and hedonia or eudaimonia on orientation. In particular, increased overall anxiety, that is not limited to corona problems, but worry and stress is conspicuous. This is consistent with reports of an increase in depression and suicide. And deterioration of mental states, that is negative feeling, anxiety and depression, and bipolarization, that is increase in positive feeling exist. Bipolarization is unexpected and new findings. And deterioration of body, mind, employment situation, and income, especially income and income anxiety is conspicuous. Now, remote work and online have improved, but the rewarding sense have declined. Assets, income, living expenses, burden, housing, employment stability, and support for the ruling party have declined. The bonds between family and friends have improved slightly, and they are related to increased brightness and decreased darkness. The importance of the home is noteworthy. Is this increase of friend bonding an online effect? Mentally, whether positive or negative, the change leads to a change in values. The number of poles of materialistic orientation and post-materialism tend to increase. This is also noteworthy. And correlation between citizenship and justice and polarization of positive and negative change mood and the corona calamity are small but robust. Because even if we conduct the multi-regression analysis, now we can see these influences. So the effects of political involvement and the sense that fairness and justice exist in political society may curb despair and depression due to corona calamity and increase positive feeling. And concerning light darkening factors, we can see the significance of civil publicness and fairness. The increase in brightness, darkness, anxiety, and extinction is related to politics, especially fairness, the economy, especially income, as well as well-being, and also are little related to culture. In terms of attributes, women and elderly people are more related to increased darkness than men and younger people. The psychological and interpersonal well-being has improved slightly, but political and the economic well-being have darkened. The goodness of physical and mental well-being is related to the brightness increase and dark constraint, but the goodness of the interpersonal well-being is related to darkness increase. The goodness of political, economics, and community well-being is related to the constraint to darkness increase. In particular, the relationship concerning political well-being is remarkable. In survey 1, the relationship between well-being, negativity, and health are as imagined. eudaimonia, community relations, and civil publicness are related to the constraint of negativity increase. Eudaimonia and civil publicness are also related to positivity increase. And justice, fairness, and change of mood. Civil publicness and just fairness are related to the increase of well-being and also to the constraint of negativity increase in coronal calamity. Focusing on justice, fairness, and citizenship, correlations between these and the positive and negative change of mood and the corona calamity are small but robust. Therefore, justice and citizenship are related to high well-being and also to the increase of positive mood and constraint of negative mood in corona calamity. In sum, justice and fairness may contribute to well-being and a positive or less negative change of mood. I think this is quite in tune with communitarian republicanism. So communitarian republicanism may enable people to increase well-being and cope with corona calamity more positively or less negativity. Thank you.
Thank you so much, Professor Kobayashi, for your very detailed explanation about the linkage between positive psychology or social well-being and also the societal happiness situation in the context of the worsening of or the calamitous, after the calamitous effect of COVID-19. So we definitely wish to ask so many questions to you because you have made a very extensive presentation, but later we wish to do that. So would that be all right? So thank you so much. For now then, let us move on to the third and last presenter. And she is, Ms.Afsana. And she's with Chiba University Graduate School of Humanities and Studies on Public Affairs. Then she has been working a lot in the field of gender-related issues. So her presentation topic for today is COVID-19 and gender-related issues. So Ms. Afsana, please.
Thank you very much. Thank you for having me here. It's a great pleasure for me that I'm going to present here as a presenter to present my small-scale research about gender. And after my presentation, I hope all your scholarly comments will enrich the small-scale social research of mine. So I'm going to share my presentation. Is this visible to everyone? Okay, thank you very much. So as Ishido-sensei said that I'm Afsana and I'm the first-year doctoral student here in Chiba University. And I'm not a very big sociologist as like the previous professors presented very well. I'm just a first-year doctoral student. I call myself a feminist who wants to work for the feminist activism in the society. So that's why I'm presenting about today the vicious cycle of gender disparity in COVID-19 and the impact of women and gender. So let's talk about the problem first, that in the pandemic situation, both men and women affect differently. So it's not only women, but it has effect on men as well. But recently what happened, like in the pandemic, we all were inside the home doing the lockdown. So what we believe that home is our shelter. So whenever we are at home, we are safe. But the COVID-19 situation was different for women. So home was not a safest place for women that time. So they were staying at home and they were facing different kinds of violence. So it's not about only the domestic violence, it has economic violence, it has like they couldn't raise their voices, and lots of things happened. They had divorce, the divorce rate increased, they lost their jobs, and these kind of problems happened. So, and it has several reasons. For example, the home was crowded, that was a problem, and substance abuses, and limited access to services, and reduced peer support. Because whenever women and the all crowded family members were there, they were not having the peer support from the other male members in the society. And that's why the pandemic, when the pandemic happened, women became more vulnerable and more struggled person. And it's not about only the COVID-19, all the pandemic situation, what happened before, it was the same. And we can say about the Ebola strike as well. It happened the same thing in Ebola virus as well. So that was the problem in this problem scenario. And let's talk about the objective, like what we tried to find out in this research and in this paper. So firstly, we tried to explore the heterogeneity of the gender disparity during COVID-19 and to analyze the violence cases from all over the world. Here, I just wrote all over the world, but as I told, that is a very small scale research. So I tried to include different countries with the secondary sources of data. And also I interviewed some of the women from different parts of the world to know that what is happening in the world during this COVID-19 with women. And also I critically tried to overview the SDGs, gender and COVID-19, because SDG covered 17 important issues in our society, and we have a target until 2030. So what happened with these ideas of 2030 SDGs, and what are the major effects impacting on the SDGs due to COVID-19 and gender? And then finally, I try to prospect the fair society concept in the current situation of COVID-19 and gender. So that's all about the objectives. So let's talk about the pilot study analysis. So as I told that it's not only a secondary data source. So I tried to interview, like an in-depth interview process that I followed. So I interviewed some of the women from France, India, Bangladesh, and Japan. So like I'm from Bangladesh, I forgot to mention. And that's why I found some Bangladeshi women who are sharing their problems of home and outside offices with me. And also with from them, I found some more Indian, French, and Japanese women with using the snowball research process. So so before interviewing them, I got to know their problem, and then I prepared a small questionnaire and then talked with them with the interview method, using the interview method. And then I tried to analyze with some social and feminist theories. So after doing that interviews and after doing that research, what I understand that there is an urgent need to adopt gender lenses to study in epidemics, because whenever we talk about epidemics, we always think of economy, that our country economy is going down. We have to talk. We have to think about more money. We have to think about our GDP and this kind of problem. But no one think about the gender, which is also the most important factor in the society. So it's not only that only if our GDP is going down and our global partnership is not working very good, then our country will be a worse situation. It's not always that. Like if women are not in a good situation, good position, women doesn't have good policies and measures to improve themselves, then the country or the society, the global society will also hamper. So this is about the pilot thing. So let's talk about the findings analysis, that what I have found when I was doing the secondary data source analysis and the interviews. So first of all, what I find that violence against women during Corona affect both developed and poor countries. So it started from China and now it's everywhere. So it's not that like that, like it has effect on developing countries like Bangladesh, like Sri Lanka, like India, and not at all. It has a lot impact on like developed countries as well, like USA, Canada, or Australia, or in Japan. Lots of things happened also. And the rate of violence against women in China, Australia, Brazil, England, and the USA increased in 2020 March, alarmingly compared to the March 2019. So United Nations always take records, like how many violence are cased every year. So what we see in this recent year, in this 1 year, it's the rate is increasing very highly. And that's also a problem. And not only women, child abuse has also been increased. So women are in the family and childs are also in the family. So during pandemic, what happened? All the childs, they were staying at home because their schools are also closed. And in Japan, there is the childs who are below 5-6 years old, they used to go to the daycare, what here in Japan they call hoikuen. These things were also closed. So all the burden came up to the women in the family. And also when the girls and the little girls and the little childs were staying at the home, they were being abused by the member of the family. Because when we talk about the child abuse, the perverts always comes from the relatives or from the close members, so close members of the family. So this thing also happened in the COVID-19 situation. And suicide rate increased. That is also because of sexual and psychological harassment. So suicide rate is not only for men, because not only for women, suicide rate increased in the case of men as well, because they were losing their jobs. So some people, they don't have their jobs, they don't have food to eat, they are losing their social status, and that's why they commit suicide. But what happened to the women? So they were psychologically harassed, they were physically harassed, they were being tortured for their dowry. So in countries like India, Bangladesh, dowry system is very it's a very weird system, that when a woman get married, she has to bring lots of money, lots of furniture, lots of gold to her in-laws. And what in COVID situation, they couldn't do that. And that's why the in-laws were doing some psychological and sexual harassment with them. And that's why lots of suicide cases we found in that South Asian countries because of that. And women are obviously taking the triple burden. So like they have the burden of the family. Some women, they were doing the part-time jobs in Japan and in other countries. So they were losing those kind of jobs because in the COVID, no people were going outside. Lots of offices, like the very formal sector offices, they were asking only 30 to 40% workers in the office. That's why they are cutting off the females. So when they are cutting off the females, they got the burden of the economy. Like they don't have job and they are not getting money. And these are the triple, and also they have the household chores burden, where the last one, the masculinity crisis increased. So what happened in the family? So we can say that it's kind of the French philosopher Michel Foucault's theory. We can work here, the docile body. So women's body became the docile body that time. So the punishment were not always the torture. It was also, so it transferred to body to soul, what Michel Foucault said in the docile body theory. And when they were always being in the home, the panopticism also happened, also the internal surveillance. So they were all the time, they were checking up that what they are doing, their activities were judged always. So they are being judgmental always, the men. So they are doing that, women, she is not doing the work properly, she is not educating her children properly, she is not doing the homeworks properly. These were judged by the men. But the men, on the other side, they were not sharing the household chores with the women in the family. And that's the masculine crisis. That's the masculinity. So they were the powerful, the men were acting as a powerful men in the home. But whenever the other men were doing, sharing some household chores with the family, and that time the positive male felt the crisis in the home. So this was a very vice versa situation happened in the family, in the masculinity crisis thing. And then we can see this, the simple demograph that what happened in the violence. So this is a United Nations demographs, and they showed that domestic violence, how it's going on. Like it was less than 40% of a women who experienced violence reported these crimes to or shout help. So this is the situation. And now, since the lockdown happened, you can see that in Cyprus, Argentina, France, even in Singapore. What do we see that Singapore, they are always doing great. They are very confident, and they're situating the power in the society. But what happened? The 33% violence rate increased, and in Cyprus 30% increase, France 30%, and Argentina 25%. It is one example about domestic violence. There are more things happened in the field of migration, in the field of economy, in the field of health service, and in the field of education. And everywhere the situation is women are being psychologically or socially harassed. And then we can see some statistics. These are all the secondary sources data. Like 70% global healthcare workers are female. So let's start from the China, like from where the COVID-19 starts. In the China, 90% of health service workers are women. So what happened when the 90%, a big number of health workers are women? They are also the more closer to the disease. So when they are taking care of the COVID-19 patient, they also are in risk of that disease, having that COVID-19 disease. So 70% in the total world, it's a huge number. So when they are working closely with the patient, they are also at risk of having COVID-19. That's why in the COVID-19 situation, a major number of nurses, the global healthcare service workers, the female workers, they died due to COVID-19. And most of the doctors, the doctors or nurses who were male, they were not the frontliner actors. They were working from the back, because the frontliners were mostly the women. So from the back, what they are doing, they were doing the online, they were taking care of the patient online. So they are not going to the hospital directly. So they were doing it through Skype, through Zoom, and only asking about the problems, and all the tests and all the major taking care was given by the female healthcare workers. That's why men were in the safest situation, and women became in the vulnerable position in the healthcare workers system. And then we can see that 76% new cases of divorces. So it's a whole world. So why this number is very high, 76%? Because that time it was lockdown. Both men and women, they were sharing the same boundary, same wall for 24/7. So when 24/7 they were together, they had many issues, not issues of, for example, one example I found while I was doing interview. So one divorce case happened because two of the person, like men and women, both of them were working outside. So it's a case in Japan, but the person were not Japanese. So both of them were migrants, and they were working in a company, two different companies. And during COVID-19, the male member of that family, he lost his job. And the female member, she was still working in that company, because that was a French company, international company, and they were not cutting off the women workers. And then when the male member lost his job and the female members were earning money for her family, so male member, he got the masculinity crisis raised in his mind, that I'm working, I'm in the family, and I'm having food with my wife's money. And that's the crisis. And because of this kind of crisis, the divorce, they got divorces. And not only for the masculinity crisis, also a lots of torture on women, sexual harassment on women, even the marital rape happened. And these are the reason behind the new cases of divorce. And next we can see that 743 million girls dropped out from the school. So firstly, when the pandemic started, soon after it started, all the schools in the world, it was closed. But when it started again, like the online or offline schools, when it started in different parts of the world, for example, Japan, after 6 months, all of the schools were opened. It's not online, it was offline. So they were doing the face-to-face classes. Also for example, in Bangladesh, it was still in some cases online, not face-to-face classes. But when it started either online or face-to-face, a number of women students, girl students, dropping out was high. So they are staying at home or doing other works. They are not continuing their school anymore after the pandemic. There are also several reasons behind that, because most of the cases, they were poor, from the poor family. They don't have enough food, they don't have enough work. That's why they are not able to pay for their education. Though education is a basic need, but in lots of countries, they think that if we don't have food, if we don't have work, if we don't have money, then education is not our basic needs. That's why lots of girls are dropped out from the schools. And then 25 million migrant women lost their job. So like, I'm in Japan, I'm also a migrant woman. And also there are lots of migrant women I know who are working in Japan, but lost their job because they're not doing the formal jobs. They're not doing the formal jobs. So in this situation, when they lost their jobs, they cannot go to their own country, and they cannot even survive here. So in that case, in some cases they do either they are having the not the correct visa, they are having the refugee visa, or their visa status changed, they become homeless, or in some cases they commit suicide. And also 180 million women, they became unemployed. And the reason behind it is, like, when the pandemic starts, all the very formal or the high class offices, they were asking only 40% to 50% workers in the office. That's why they decided to cut off the women workers. So the 40% workers who were working in the office, they all were male. And the female workers, they were cut off from their job because they have problems, they have issues with their childs in the family, they have issues with pregnancy, they have other issues, they have issues with every month, even in Japan, like there is a law that women can get paid leave every month for their menstruational sickness, but only 0.9% women take this. Because if they take that leave in the next month, maybe their office will do that docility with them, and they will punish them with cutting off their jobs. And also 810 million women died, 10 women died every day during their childbirth. So why this thing increased in COVID-19? Because in the COVID-19, in some countries, only the hospitals were only taking care of the pandemic patients, the COVID-19 patients. So they are not taking care of any pregnant women, any women who already gave birth, just gave birth to a child. That's why, due to less care, 810 women died every day during the childbirth in pandemic. And next, these are some quotations from my respondents, which I got when I was talking with them about this issue. So first one is from India, Jharkhand, India. So she said that we did not have food at home. We are 3 sisters and 2 brothers. My father is drunk always. And due to the pandemic, my mother lost her household job. And so my father forcefully sent me and my 2 sisters to the sex worker brokers. So in this case, what happened? Like the father, he's not responsible for his family, and he's not taking responsibilities. He's the mother of this family, the female of this family, she was working the household jobs. So due to pandemic, India has a very serious situation. That's why the household workers, the maid, they were not able to work in those homes because all of them were in the lockdown situation. So when they lost their jobs, the father, he did not do anything with his sons, because they're the son, they cannot do anything. They have only some works to do outside. But what happened with the sisters, with the person I was talking with, 3 of them were took to the sex worker brokers, because women's body is always judged. So women cannot do anything, but women's body can do a lot. So whenever we think about gender, whenever we think about sex, we talk about women's body. So we think that women's body is not a subject. When we think women as an object, that's why it happened, like this problem happened, that they became the sex workers after the pandemic. And next one is from Grenoble, France. And this case is not from a very poor family. It's a very higher class and up top, like we can say that top class family from France. And she said that my husband is working in Atomic Energy Commission of France. And since the corona broke out, he's working from home. He leaked down that he became violent to me, and his masculine behavior became more prominent. And she also mentioned that 32% domestic violence increased during these days. So we can compare these 2 situations, what happened with the Indian case and what happened in the France case. So both are, it's like what poor families, when there is no money, then what happened? They became sex workers. And when there is money, they have everything, still they have the sexual violence, they have the masculinity problem. Because when the husband is at home, he seems that he is the husband and he has the most powerful attributes, and what he says, the female has to do. And that's why the problem arised. That's why he presumed that I can do anything with my wife. And because of this problem, 32% domestic violences increased during these days in France. And next case is from my country. It's from Bangladesh, Dhaka. And she said that I cannot even go to the hospital for treatment after being tortured at home, as hospitals are not taking any cases except COVID. So this is the very worst situation. Even like they were being tortured and they were not able to say to anyone. They were not able to go to the hospital, not even to the hospital. She also mentioned about the police. So they said that not even the police were taking the cases of sexual harassment, because whenever police take a sexual harassment case or a domestic violence case, they are bound to send the girl, the victim, to the hospital. So that situation, the police stations, they were not able to send the victim to the hospital. That's where they were not even taking the cases. So the cases, the domestic violence cases, in a sense, it was increasing, but it was not filed. It was not filed, and they were not getting the proper treatments as well. There are 2 more cases. One is from Japan, Yokohama, and another one is from Kolkata. So I will just read it. The Japan one is, I work in a well-renowned Japanese company, and during COVID, my office allowed 20% workers in the office and 60% were doing home office with less payment. So I was among those 60%, as I'm a woman and don't have voice. So this Yokohama woman, she is also from a very high-class family, higher class society, as she also struggled a lot to get that job. And she said that she is the only manager in her arena. She's the only manager, but she was almost fired during that pandemic situation, because they said that you will get less paid, like you will get only 50% payment, and then you have to work from the home. And being a woman, she couldn't say anything, and her voices were countless. And the Kolkata case from India, like she said that I'm only 16 years old. According to the law of my country, I'm underage to get married, but my parents bound me to get married to get rid of the burden due to pandemic. Also, my in-laws are not rich enough, so now they are torturing me for dowry. So being a Hindu woman, I cannot even ask for divorce. So if you know about the Hindu religion, you may know that in the Hindu religion, the marriage registration is not mandatory. That's why in most of the cases, they cannot even ask for marriage. And this thing happened in the India, that law was not doing anything with it. So she was only 16 years old. Like she got married, and it's a child marriage case also, and it's a dowry case, and it's a torturing case. So 3 cases happened because of the pandemic, because of the COVID-19, because the girl's family thought that the girls are the burden in the family in the pandemic. So she cannot earn and she is eating. That's why she's a burden. And that's why she got married. And also in the other case, the in-laws are torturing for the dowry. So that's the thing. So these are all about the cases, and let's talk about the SDGs now, like how it's like we know that SDGs has a goal until 2030, but how this goal will measure its increasing rate as the COVID-19 situation has lots of facts that are the reason of not getting the higher results in SDGs. So I have tried to include some of the SDGs results, for example, number 1, 3, 4, and 4, 5, and 6. So the number 1 is the no poverty. So in the no poverty, we can see that 193 million girls started to living no less than $1.9 a day. So it's all these data are after or during the COVID-19, and SDG number 3 is the good health and well-being, and 810 women died from pregnancy and childbirth related problems. So that I explained before, that in this good health and well-being situation, what's happening with the women in SDG 3. So whenever these days in pandemic, we talk about SDGs, but we are talking about the global SDG. We are talking about a vague or a very blurry SDG that only concerns of men. So we think that there are 17 goals and 16 are related to men, and only 1, the gender equality, is related to women. So if we think like that, nothing will happen after 2030. It will be same, because if we exclude women, the half of the percentage of the world, then the half of the percentage of the world who are men, they cannot do alone anything. So that is happening here. And SDG 4 is the quality education, like 743 million girls are dropped out, that I also explained before. And of course, in the gender equality, the SDG 5, 750 million sexual harassment and gender violence cases, and 12 million girls married before the age of 18. So if this type of huge numbers are happening within this 1 year, then how can we measure the increased rate of SDGs within 2030, within these 15 years? And then the last one I tried to spotlight, that is the SDG 6 on clean water and sanitation. Like 300 million women and girls have lack of menstrual hygiene management. So during this COVID-19 situation, only the COVID-19 patients in some countries, only the COVID-19 patients and some emergency and frontliner actors were allowed to go outside. That's why a lots of women were not going outside to buy their sanitary napkins as well. That's why what happens, they were using very old methods during their old methods of menstruation management, and which were not hygiene. Some of them some of them were not even aware about the unhygiene things. Then what happened? So because of this, also the SDG 6, the clean water and sanitation, is not working properly in this 1 year. So in this 1 year of the 2019 to 2021, in this period of pandemic, this kind of problem happened in the SDG situation, like within the women's boundary, not only the global boundary, only the women's boundary. These problems happened. And here there is the fact that the burden of responding to the immediate and long-term impacts of pandemic also threatens women's involvement in politics in the long term. So women's involvement in the politics is still very low. If we talk about my country, we can see it's visible that our prime minister, our speaker of the parliament, the opposition party, all of them are women. But like how far they are working by themselves, how far they're working. And during the pandemic, what happened? A lots of women politicians who were working before, they left the politics. They say that, okay, politics is a philosophy. So when we talk about philosophy, it's for the higher class people. So when we have food, we can talk about philosophy. When we don't have food, we cannot talk about philosophy, economics, and politics. That's why it's a burden that if the pandemic is in the long run, if the pandemic happens and we don't we don't spotlight, we don't zoom in the situation of women in the society, then the involvement of women will also become very less in the politics. And then what happened? We will not get the policies and the measurements which will bring with the good things for the women. So which all the if all the legislators are women or men, then the laws will also come in the favor of men, not in the favor of women. And to talk about the fair society, like when we say something fair, it's the society. If society is fair, it's a complete structure. It's not only women, not only men, not only politics, and not only economy. It's a total thing. Like society is a complete structure, including all its institutions. Institutions, as in it's a religion. Religion is include the society, includes family, is include everything. Education is included, and the industrialization. Everything is included, which starts from the family. So if we say about the fair society, we have to talk about the Judith Butler's performativity, because in pandemic, all the family members are in the house. So performativity here works. So the little children, what they think, what they see, they will perform accordingly. So in this pandemic, if the man is not working, a man is in his family, if he is not acting as a positive masculine in the family, then the children will not follow the positivity. Then the patriarchy will sustain, and we will never find a fair society. Because if we exclude gender from the fair society, we cannot get a proper fair society. Without gender, without women, a society cannot be fair. And pandemic creates a crisis in migrants and masculinity, which in the long run, it leads to vulnerability towards women. And also the COVID-19 is a symbolic image which shows how pandemic create risk on women's lives. So it's a symbol that it's happening from the birth of the society. But COVID-19 shows as a symbolic image, like which shows that how it creates risk in many parts of the societies. It's in the family, it's in the religious institution, it's in the society, it's in the office, it's working environment, it's in the education, it's everywhere. And finally, I want to say that to establish a fair society, the gender fair language includes everything, where from the language also, when we talk about anything, we like, for example, it's a simple thing. If we say camera person, we don't say camera person, it's a cameraman. So always we are excluding the gender fair language. We are excluding women from everywhere. So if we exclude women from everywhere, we cannot have fair society. So to have fair society, gender fair language, including the gender fair language, is very important. It will demolishes the gender stereotype and the discrimination. And finally, for the closing remarks, it's very simple that I want to say that instead of focusing entirely on stopping the pandemic, the public service community needs to ensure the existing health and social services for women to maintain their unique needs. Like I said, that a lot of women are leaving their job, they're firing out from their job because they didn't have crèche, they didn't have daycare in the offices. There are lots of women who are working in the offices, but they don't have their daycare. That's why they cannot take their children in the office, and they cannot get tension free while they are working. So this kind of thing happens when a pandemic happens. We should also think about the who are the catalysts in the society, who are the actors in the society. If we think about only to stop how to stop the pandemic, how to make vaccines, how to get all the vaccines to the people of the society, it will stop one kind of problem, but another kinds of problem will arose in the society. That is the gender problem. That is the society problem. And if we want to think about those problems, we have to think about more public service community, more services from the government, more services from everywhere, so that women also can survive nicely in the parallel basis of men in the society, even if there is a pandemic or epidemic. Thank you very much for this. I hope you enjoyed the presentation, and if you have any comments, maybe next session, Sensei will lead to it. Thank you very much.
All right, so thank you very much, Ms.Afsana, for your really passionate talk about what has been happening mostly in South Asia. You're from Southeast Asia, and so I did not know many things about the gender-related issues, which could lead to a humanitarian crisis, right? Through this what you call this masculinity crisis, right? So let us discuss this issue later on further. Thank you so much, Ms. Afsana. So. Three speakers have already done their nice job. So let us move on to the panelist speaking session. So each of the panelists has about 15 minutes. But okay, so Professor Jiro Mizushima, Director of this research activities, please come to the floor.
Thank you for the three speakers. I enjoyed the lectures very much, and they were very exciting and insightful. So because of the shortage of time, probably I would talk about 10 minutes. That would be better, I think. And about the lecture of Lindsay, Professor Lindsay, it was quite interesting to know the development of the COVID-19 and the policy reactions in Australia. And it was quite interesting to know the difference between the political background of the states and its impact on the policy and the infections situations. And I would like to know about the reasons of the difference between the states, blue states and red states. Because as you explained, in the progressive states, the number of infections were relatively high. And in the conservative states, it was safer. But it seems somewhat strange to me that in general, conservatives like to, they don't like restrictions, and in conservative countries, the infections might be larger than progressive countries, because progressive politicians like to tighten or they like restrictions on the behavior of ordinary people. And then it might be natural that the infections would decrease. For example, in the United States or in Brazil, the conservative governments under Trump and Bolsonaro, we saw a rapid expansion of COVID-19 because conservative leaders, they don't like science, they don't like restrictions, they like prosperous economies, so they don't introduce lockdowns. But the situation in Australia seems opposite. So why is it? I would like to know the background of these differences. Okay, and next, the lecture of Professor Kobayashi. Professor Kawase explained about the well-being, the relationship between well-being and the COVID-19, and especially about justice and fairness. And it was quite a unique research. And Professor Kobayashi explained about there are only but a few positive elements, positive aspects, because we saw some increasing bonds with family and friends among the people. So it might mean that under the pandemic, people discovered the value of bonds with family or friends. But it is interesting that it is natural that we, under the lockdown, under the stay home, we talk much about with our family members, and we discovered the bonds with family. But about friends, in general, we see fewer friends in last year and this year. But it seems, but according to the survey, people discover the value of bonds with friends. So it seems somewhat strange to me. What do you think about the reason behind these bonds with friends? And about post-materials value, it is also quite exciting to see because of the pandemic, people discovered the value of post-materials situation. So they prefer more spiritual aspects of life than money. So it might seem a positive change of minds of people. Professor Kobayashi, do you think after the pandemic, this change would be reversed, or this change would endure, namely the turn to post-materialist value? I'm eager to know the development of people, the attitude. And about the lecture of Afsana, thank you very much. And you explained quite clearly about the disparity between gender under the pandemic. And as you clearly explained, the disparity or the disproportionate burden of women, that varies not only in economic aspect, but also mental and social and other physical aspect. So as you explained, the SDGs, the purpose, the objectives of SDGs itself are not enough for us to understand the situation of women under the pandemic. I totally agreed. And your metaphor about panopticon is quite unique and interesting to me. And I think that there emerges double panopticon system. It means under the remote work system, people, many white-collar workers work from home, and it seems we get freedom because while we hear the voices from my PC, I can do other things. So, however, not quite a few, many companies introduce a system to control the workers at home. So they can control whether the workers at home are truly doing their jobs. So it seems that we see a modern panopticon system. So the companies at the headquarters can control every worker during the working time. But we have to see that these workers are mostly male. They are controlled by panopticon system from the headquarters, but these male workers dominate women at home. So it's a so-called double panopticon system. So they control from the headquarters the male workers, and the male workers control women at their house, at their home. So we see the emergence of these double-edged panopticon system, and we have to elaborate more about it. And you explained about various kinds of negative aspects of disparity, gender disparity. But as a political scientist, I see some bright aspects about gender, because last year and this year, we see a couple of quite excellent female political leaders in the world. German Prime Minister Merkel, the Prime Minister of New Zealand, Ardern, and the political leader of Taiwan, Tsai. They're all female leaders. And we see clearly that they follow the advice of science, and they are quite calm and self-restrained, and they talk to the public they can talk quite clear message to the public. So other than Trump or Bolsonaro or other male leaders who don't like science. So I can see this. I can interpret it as a positive change about female and politics. This itself is a great achievement, I think. What do you think about that political aspects? Thank you.
Thank you so much, Professor Mizushima. So for the sake of our time, let us move on to the second panelist speaker, Dr. Kawase. Actually, he has his own presentation title, Justice in Emergency. And he will also make some comments on the lecture, 3 lectures. Thank you so much. So, Dr. Kawase, please.
Thank you very much. So I have my own
voice level.
Do you hear me? Okay.
Yeah. Okay.
Okay.
Please.
So actually, I have my own presentation. So let me share that. Do you see this?
Yeah.
All right. So let me start it. So thank you very much again, Professor Ishido, and thank you so much for inviting me to this great seminar. My name is Takayuki Kawase, and I teach philosophy of law in Chiba University. Usually, I research issues such as what is justice or what is fairness, and how should we think about the value and so on. And today, I would like to try to apply these questions to the case of emergency of COVID-19. In the last year and a half, almost all people in the world were upset, and some of them panicked and despaired. However, I think it is exactly now that philosophy can show its true value. Because in the emergency, we cannot use our existing common sense. Emergency reveals the essence of so many kinds of problems, such as hidden nature of persons or dirty aspects of societies. I think it is the responsibility of philosophy to confront such problems. My presentations consist of 3 parts, and after that, I would like to make some comments or questions to main presentation of 3 professors and doctors. The first of my point is about risk assessment. In the last year and a half, we have had so many controversies about risk of virus and vaccine and so on. In my opinion, not only risk assessments, but also all human behaviors of assessments are plural sort of things. So it's plural. By plurality, I mean human actions of assessments are not objective, but subjective or sometimes intersubjective. It is individuals or groups that assess some risks. There are no objective risks which is transcend or independent from any kind of individuals or groups. So there are different correct opinions about risks. This is quite natural in liberal societies. But on the other hand, such plurality brings about social divisions and segmentations. In such cases, people do not listen to other opinions. So some of them do not listen. So for example, vaccine conspiracy theory is one good example in my opinion. What is the reason of this tendency? One reason might be that people exchange their opinions only inside the same-minded groups and make their opinions more and more radical. Another reason might be that people who have feelings of being alienated from society take closed mind. There is a vicious circle of segmentation. It is a very serious problem in my opinion. And my second topic is about the rule of law. In the last year, so many Japanese people criticized Japanese government that why not our government takes strong measures of regulation. for example, against pachinko parlor or such kind of that. And many of these claimants did not understand that governments cannot take any actions without legal permission. Some of better arguments claimed that government should take extrajudicial measures in emergency, despite of understanding the importance of the rule of law. This type of second argument is worth rejecting, so worth objecting. And this is formidable argument, I think. In emergency, it is natural that people want consequentialist idea rather than deontologist idea. Because in many cases, consequentialism is more flexible than deontology. I agree this opinion. However, in emergency, people tend to seek very short-sighted consequences. I consider we should think from a longer term of perspective, so long-term perspective. We should remember that our behavior are assessed by those who are in the far past and those who will be in the far future. This is my own careful and conservative standpoint. If we adopt long-term consequentialism, I speculate that consequence of respecting the rule of law, even in the emergency, is much better than ignore the value of the rule of law. We should not sacrifice long-term interests in order to get short-term profits. But all of this is the matter of fact. So we cannot say my speculation is correct or not in advance. Everything is accessible only retrospectively. My third and last point is about collective decision-making. Many Japanese people insist that Japanese government is opportunistic and takes only ad hoc measures without any definite strategies. However, I think public policies can be implemented only in the piecemeal and gradual method of trial and modifications. We cannot recognize any best answers in advance. Thinking a priori best answers existing and recognizable and achievable is utopianism, in my opinion. I think this idea, this utopianism, might be very, very dangerous because radical idealism can bring about catastrophic results. If people cannot stand without socially shared and fixed answers, they are not autonomous nor independent. Because they are just waiting for someone else, for example, the government giving some answers to them. They should people should find their own answers by themselves, and they should admit these answers may be different from others. So it is the plurality. If individuals have mental weakness, their society must be weak, in my opinion. So yes, our government is very, very indecisive, but it is because we are indecisive and dependent. And I think this is all, so basically I am opportunistic person, but today's my argument may be a little bit pessimistic. I hope this world is actually better than I expect, but now let me go on to my comments or questions to three main presentations. So this is all of my own argument. The first is my questions to Professor Oades. And I think Australian and New Zealander ways of handling pandemics are outstanding, and I really respect them. My questions are about the difference of the strategies on pandemics between United States or United Kingdom and Australia or New Zealand. The first group of countries looks very pro-freedom, and the second group looks pro-security. It might not be very accurate, but anyway, originally, these four countries share the traditions of Anglo-American individualism and liberalism. However, why did such differences come out? What would philosophers of consequentialism, such as Friedrich Hayek, say? Would they support for being skeptical about the government's ability to handle pandemics and keeping freedom of individuals? Or would they admit to restrict personal liberties in order to improve social consequences? Which strategy is the orthodox successor of the Anglo-American tradition or history of liberalism? So this is my questions to Professor Oades. And next is my comment and questions to Professor Kobayashi. Professor Kobayashi adopts an evidence-based method. This is very different from my own method, which is very abstract and metaphysical, and I am very impressed very much. And my question is that, how far is it possible to recognize human happiness or human well-being by questionnaire survey? What is revealed by questionnaire survey is respondents' subjective senses. If happiness is defined as subjective senses, questionnaire survey is a very, very good way to get evidence about respondents' happiness or well-being. However, there are other ways of defining human happiness or well-being. For example, consider a famous example of experience machine. This person feels himself happy, but most of us may think this is an illusion or fake happiness. If so, does not questionnaire survey on him give us any evidence about his happiness or well-being? So this is my question to Professor Kobayashi. And the last is a question to Ms.Afsana. I think gender issues are deeply related to almost all social problems of these days. Of course, it has huge implications with pandemic. Other than gender issues, there are a lot of interesting data on the correlations between many social characteristics and attitudes about the virus or vaccines, especially the risk of side effects of vaccines. A good example is age. Basically, elderly persons are positive about vaccines. The reason may be very easy. The more elderly persons are, the more vulnerable to virus they are, and the more insensitive to the long-term side effect of vaccines they are. On the other hand, income may be more complex issue. Basically, low-income persons are negative about vaccines. This needs more detailed explanation, I think. But now the topic is gender. Are there any differences in attitude to virus or the COVID virus or vaccines, especially vaccines, according to genders? Genders are basically socially constructed kinds of things. If so, what kind of social reasons or social structures bring about the difference between genders? Probably, you already showed a lot of things in your presentations, but it would be great if you tell me something about more about your opinions. As you say, I think the burden of babysitting or raising children may be one of the answers. But anyway, this is all of my presentation. Thank you very much.
Right. Thank you so much, Dr. Kawase, for your detailed presentation and also comments. Well, it's going to be my turn, but I wish to move on to the responding part, please. And then I would like to make a very brief summary comment at the very end. So can we at this point ask Professor Oades to please kindly respond to all these comments? I mean, not all, some of these comments made. Thank you so much. You have about 5 minutes or so, please. Thank you very much.
Good. Thank you very much for the comments and the questions. My first response regarding the comments that perhaps what was happening in Australia seemed unusual in that it was the wrong way around. That is, the conservative states were not having outbreaks of COVID. Well, I should say conservative state. Perhaps we'll focus on New South Wales and Victoria because that's the majority of where the debate has been illustrated. So New South Wales, the conservative state, in 2020 did not have the outbreaks, whereas the progressive state, Victoria, did have the outbreaks. And that is unusual based on probably world experience as was illustrated. And I think that's what's made it so interesting, because the federal Conservative government exploited that very much so, and was making fun of or criticising the Victorian Progressive government, and saying that their lockdowns were not necessary and they had poorly managed everything. However, that changed very much and that was the first strain of the virus, and that was pre-vaccination in 2020. In 2021, as I outlined, we had very slow vaccination uptakes, and we had the Delta virus which came, and that did affect New South Wales, the conservative state, first, and then Victoria, the progressive state, it affected also. And they both went into restrictions and lockdowns, as well as the vaccinations were coming. So, but the attitudes as outlined, as expected by the conservative, promoting individual liberty and pro-business, was very, very prominent. As was the public health initiatives by the progressive government. So it sort of returned to normal in 2021, as would be expected by social science and that area. And I think that's what's made it so interesting, is it's seeing those real social phenomenon play out, and now that the vaccination rates are getting much higher and are approaching 80, or they're over 80% in New South Wales, and they're approaching 80 in Victoria, a lot of it's becoming a moot point. But in the 18 months prior, it was a fantastic illustration of the political ideologies and the interaction with politics, economics, and public health. My second answer to the second set of questions about the United Kingdom, USA, Australia, and New Zealand, obviously with their liberal individual backgrounds, I would agree there are aspects of management of the pandemic that have been excellent in Australia and New Zealand. Probably the major problem was the delay in the purchase of vaccinations, which created a lot of frustration, which led to the state governments using lockdowns and restrictions as their major tool. And that's so the debate, as was mentioned, has been very strong. It's been liberal individualism and pro-business versus public health and the use of restrictions for public health measures. The comment about how is Australia and New Zealand perhaps different, Yes, Australia very much obviously had liberal individualism as its beginnings, but in the middle half of last century, we're very much a social democracy, and probably it's a liberal individualist nation, but it's been overlaid with some very strong public policy about public health. So it's kind of got both strong public health attitudes of the average Australian, but underpinned by a liberal individualist democracy and legal structure. And I think, and because it's been geographically illustrated, and I guess that's what I was trying to illustrate of the New South Wales versus Victoria debate, it's actually been illustrating exactly those issues. So I would agree with the question. Yes, I do believe Australia has managed it overall very well. Yes, it has its liberal individual origins, but it has been overlaid by a public health, strong public health and public policy frame. HIV/AIDS was probably a good illustration. We had some excellent policy on that when it first came. So that's my answer in terms of sort of understanding the seeming contradictions. Yeah, I don't know if that was 5 minutes, but hopefully.
Yeah. Oh, thank you so much. Thank you so much for your very brief comment. Yeah, thank you so much. Okay, so can we now ask Professor Kobayashi to respond? Thank you very much.
Thank you very much for very important questions. And first, in response to Professor Mizushima, as for the value of family and friends, I think that your opinion is pretty similar to mine. I can easily interpret it, the increase of family bonds evaluation, but I'm a bit puzzled by the friends bonds. The first interpretation is that this is done by online means, because it is difficult for us to meet directly with friends, but this situation enables us to see the importance of friends or acquaintances. And so using the method of online, we can evaluate the importance of friends. This is my first interpretation. The second interpretation is that, as I said, that there can be the value change in various people. So the value change towards evaluating the importance of spiritual or mental value tend to enable us to see the importance of friends as well as family. This is my tentative interpretation. As for the second question, and I think that value change towards bipolar change towards material and post-materials is very important and noteworthy because this reminds me of the Ronald Inglehead's works on post-materialism. He discovered that after the Second World War, the value system turned towards the materialistic, but 20 or 30 years, that is 1960s and 1970s, younger people tend towards the post-materialistic value. But we find that at the present time, there are bipolar, that means towards materialism and post-materialism. So it is important to see the subsequent development after the corona. My guess is that we cannot return towards the society before corona. So that means that perhaps some people value materialistic value as a result of the unhappiness by COVID-19. But the other persons tend towards more post-materialistic value orientation. So my guess is that the bipolar development would develop or would continue after the corona. But I'm sure, so I would like to examine the trends after the corona. And my answer to Professor Kawase is this. Actually, I study political philosophy, so a philosopher as well as you. So my main interest is obviously philosophical question, but I try to bridge philosophy and science. this is my new attempt. So your question is very hit the mark, because I think that the relationship between objective and subjective is perhaps one of the most important issues for us. And Professor Ishido is very interested in the exploring these two sides, including objective side. Not only happiness, but also justice and citizenship. I can see the two aspects of objective and subjective. The present presentation today only focuses on subjective side. This is a new frontier, I think. So I use the word of positive psychology learned from the previous works by positive psychologists, including Professor Oades. So the next stage would be try to integrate the subjective research and objective research. I call this an integrative approach, which comprises these two aspects. But this is a new frontier. I would like to do something about that in the future. Thanks. Oh, can I say one question to Professor Oades? And Professor Oades, thank you very much for your presentation. So my question is, as for the well-being, I have been frustrated by Japanese governments coping with COVID-19. So I admire the Australia and New Zealand policy on COVID-19. So my question is that the well-being policy by New Zealand and Australia have impact, good influence on the policies by both governments. And also that kind of policy or a policy orientation influence the difference between a red area and blue area. Can I suggest something about that? That's my question. Perhaps you can answer after the
please, Professor Oades, please then.
Right.
Yes.
Sure. Yeah. If I understand the question correctly, Professor Kobayashi, is whether there's differences in policies in the red conservative states, or the red progressive states. We have it the opposite. The colours are the opposite as they are in the US. And is that your question? Is there differences in policy in the different states politically?
Right, that's the point. But I also asked about whether there is the impact of well-being policy on the policy on COVID-19, because I heard that well-being was valued in Australia and New Zealand.
Okay, yeah, thank you. Explicitly, there's more well-being policy in New Zealand with well-being budgets, etc. However, we must remember that New Zealand is a similar size to Melbourne. So when we say New Zealand, it's almost like talking about Victoria in terms of size. And the reason I make that point is my anecdotal observation is that it's been easier to implement these new policies in some smaller countries. But anecdotally, I'm also told that a lot of those countries are led by women. So that's an actual one for the gender discussion. There is, what I have noticed, I haven't seen it reach major public policy in Australia, but there is an absolute increased awareness of mental health and well-being because of the pandemic, and certainly in the education state education policies, there's a lot more well-being policy happening in response to the pandemic. But at a national or whole of government sort of public policy across the board, not yet. But just not so much at a government level, but if I talk about my own Centre for Wellbeing Science, there's been a huge increase in inquiries to us since COVID. People knew about mental health, but they probably didn't know as much about well-being, about how to get through your day, how to maintain your relationships, sort of all of the broad aspects of psychological aspects of well-being, as opposed to the more clinical mental illness. So I would expect and hope that we will see more well-being public policy in Australia as a result of COVID, and as I said, we already are seeing some in the education sector.
Oh, thank you so much, Professor Oades. Okay, so please, Ms.Afsana, make your responding comment.
Firstly, I'm going to answer Mizushima's question. So, since as you have said that about German and New Zealand.
This is mute.
Oh, can you hear me now? Sorry, I was mute.
No.
Okay, sorry for that. So as you have said that about the women leaders in Germany and New Zealand, these are definitely good things, but I think that we need to have simultaneously the good of men leaders parallelly so that they would accept those women leaders in the society. For example, I can say about Japan, you maybe know about Yoshiro Mori. So who was the director of Olympic, chairman of Olympic. So what he said about women, he said that women are talkative, so they need not be in the sports directory position. That's why, and he also said sorry for that, and he also he was not anymore in the directory level. But if this kind of things came out from the male politicians or male directory position men's, so women will not be able to step ahead in the politics. So that's the thing, I think. And after that, Professor Kawase's question. So thank you very much for the question. So about the gender disparity differences. So of course, the division of jobs is the first one, the employment sector. So in the most of the societies, what we think that there is an inherent belief that the men are simply the better equipped to handle certain jobs. And that's why most of the time, those are the jobs who place the best in the are the men. And the discrimination result is lower income for the women. And not only the division of jobs, but also there are some more reasons behind the gender inequality or differences. For example, the uneven access in education, the segregation, job segregation, and the legal protection, also in the medical care, also in the religious freedom. So when we see about the religion, so all the topmost persons are the male. So women are also lagging behind in the gender relations, gender differences in the religion as well. Also, as Mizushima Sensei said about the political representation. So those are very few, not very high range in the society. And racism is also a reason. And for the gender difference, I want to conclude my answer saying one thing, when we are born as a woman, not as a human, because it's not a, when we are in the hospital, if I am a girl, I am wrapped with a pink towel. And if I'm a boy, I'm wrapped with a blue towel. So the stereotype, the gender differences starts from we born. That's why even if it's a even if it's a social differences, so it continues in everywhere in the world, all the situations in the society. Thank you very much.
Thank you so much, Ms. Afsana. So let me have the privilege of just showing my presentation file just briefly, 1 minute. Okay, so I really wanted to thank all of your presentations, and then also in the face of so justice and well-being have been the focus of our topic, international symposium for today. And then this is just a perspective from medical ethics. I will not read this, but 4 principles: respect, beneficence, non-maleficence, and then justice, equality. So for policy making, gender issues, we need these ideas, principles, not our right. We do not claim, doctors do not claim, oh, this is our right, medical caretakers right. No, respect for autonomy, beneficence, non-maleficence against others, justice. We could also have this kind of attitude. And then we also need science. a risk return frontier from economics. Sorry about this, but the best choice portfolio, talking about three arch issue. What kind of different uncertain and different claims can be sort of solved using scientific method. I will skip this, but enhancement of social well-being, mitigation of disastrous impacts could be done by science. And then, of course, the importance of SDGs. And then lastly, bonding, online bonding, like in this kind of situation. Without any reasoning or science, we need bonding as human beings. So we are all online colleagues and friends after today. Thank you so much. Okay, so lastly, can I invite Professor Mizushima for his brief final comment?
Thank you for the excellent lectures and responses. I really enjoyed the discussions. So 2.5 hours. At first, I thought it would be too long, but after that, it is too short. So we could not fully discuss in details. However, we recognize the important aspects of the social impact of COVID-19 in world justice. So we could do it later or so in the future. Now we have to conclude this meeting. Thank you very much for joining us today.
Right. Okay, so thank you so much. That concludes today's International Symposium. Let us clap our hands for everybody's achievement. Thank you so much, Professor Lindsay Oades, and then Professor Masaya Kobayashi and Ms.Afsana for your very enthusiastic lectures for today. And then panelists, Professor Mizushima, Dr. Kawase, thank you so much. So that's it for today. Let us continue to work on our issues jointly, hopefully. So thank you so much. So that's the end of today's session. Thank you very much.
Thank you very much.
Thank you so much. See you.
Thank you. Bye-bye.
Thank you so much, Professor Oades, for your contribution.
Thank you
very much.